According to the Glaucoma Research Foundation, glaucoma is the leading cause of irreversible blindness, and more than 3 million people in the United States have the disease. Carolee McGrath sat down with optometrist Dr. David Momnie of Chicopee Eyecare to learn more about the disease, those most at risk, and how an annual eye exam is the best way to protect yourself.
Glaucoma is a group of diseases of the optic nerve. Light enters the cornea, goes through the lens to the back of the eye. There's an anterior and a posterior chamber. Fluid, the eye is filled with fluid. It's watery, it's not air like a basketball. And the fluid is produced in the back chamber, flows through the pupil into the anterior chamber where it's drained out of the eye. In glaucoma, the pressure backs up. We don't know why, but the pressure builds up, and that pressure eventually transfers to the back of the eye where it damages the retina. So the definition of glaucoma is really damage to the optic nerve, and it's pressure related. It's related to the eye pressure.
And it happens over time as people lose vision, because I know it's been described to me as almost like a tunnel vision where it starts to close in.
That's what's dangerous about glaucoma. It starts off with very small peripheral defects of vision, and it gradually moves into central vision. One of the more complicated problems with glaucoma is that there's no normal pressure. There's average pressures, and average pressures might be around 16, but everybody has a particular pressure that beyond that would cause damage to the nerve. So nobody should tell you you don't have glaucoma, your pressure's 16 or 17. We don't know why, but some people develop glaucoma with low pressures, pressures of 10 or 12. Other people are very capable of handling pressures of 22, 24, even higher. So there's no magic number. There's average, but the only way to really rule out glaucoma is with a careful examination of the optic nerve, preferably through a dilated pupil.
Okay, so when you go to the eye doctor, is that something that would be picked up?
It should be picked up in a comprehensive eye exam. Tonometry is what the glaucoma test is, the pressure test we call it, but that just gives us a number. And like I said before, it's more involved than that number. You also need to have the optic nerve looked at carefully through a dilated pupil to examine for any damage. So there's no special number.
Okay, and can people have it and not realize they have it, like have maybe the early onset of it?
That's the frustration, that's the danger of glaucoma. It's called the silent thief of sight because it's asymptomatic. There is no pain, no redness, no blurred vision. It's easy for us to have somebody read an eye chart and see how well they read on the chart, but it's not easy to check peripheral vision. It's harder to measure. So it's very easy to have early glaucoma, yes, and not know it. That's why you really need to be checked for it.
So if you do get it detected early on, what can be done?
The goal of treatment is to lower the pressure. And there are 3 ways we can lower the pressure. One is with eye drops. The drops that we use now are very safe, very effective. When I first started in practice 45 years ago, they had a lot of side effects. They were very strong. But the current drops that we use now are very effective. A second way of treating glaucoma is with laser. And again, there are major advances in lasers in the last few years. And they shouldn't be confused with the lasers that are used on the retina for macular degeneration. Sometimes lasers are used with cataract surgery. But these are very safe lasers. And they also are used to open up the drainage system, just like the eye drops are. They're used to open up the drainage system. The third way we treat glaucoma, ophthalmologists would be the ones that would perform surgery. And there are various surgical procedures. And there have been some remarkable advances in surgery in the last 5 years. They're called MIGS, micro-invasive glaucoma surgery. And so some of these are used in conjunction with cataract surgery, and some are used independently.
And so this slows it down? Does it cure it?
It slows it down. There's no cure for glaucoma, unfortunately. All we can do is slow the progression. However, with the drops, the laser, and the surgery, we really can stop glaucoma in its tracks. The key is to detect it early on in this stage.
And you mentioned macular degeneration. Explain the difference. You said, I guess in layman's terms, glaucoma is almost like tunnel vision, but what happens and what's different about macular degeneration?
Macular degeneration is what the definition says, or what the term says, degeneration of the macula, the center of the eye. So people with macular degeneration will present complaining of blurred vision. There are two types of macular degeneration, the wet and the dry. And typically, the dry type progresses very, very slowly, very gradually. The wet can progress very quickly. But that's what separates the two. Even cataracts, when patients come in and they complain of blurred vision, cataracts will blur your vision, cause glare, trouble at night. Glaucoma is different. Glaucoma is patients come in. The patient we hate to see is the one that comes in smiling. I haven't had an eye exam in 10 years. I can read letters a mile away. I wear reading glasses from a drugstore. I'm fine. And we look inside, and there's serious damage to the optic nerve, and they've got progressive glaucoma. So it's why we stress that if you're over 40, you really should have your eyes checked at least every 2 or 3 years.
Are there certain people who are more at risk?
There are. The one major risk would be a family history. If you've got a mother, a father, a brother, a sister with glaucoma, you're at a higher risk. Certain races are more at risk. African Americans, Mexican Americans have a higher risk of glaucoma. There's one type of glaucoma I didn't mention. It's called narrow angle glaucoma. 99% of glaucoma is open angle, which is the asymptomatic type, no symptoms. But this small segment of glaucoma called narrow angle, Asians are more at risk for that. And there are a few other risk factors, diabetes, high blood pressure, high nearsightedness if you're very myopic, having a thin cornea are other risk factors.
As well. So the bottom line is you really need to be making appointments to get your eyes checked.
You really need to be checked. If you're over 40 and you're a low-risk patient, I guess an eye exam every 2 or 3 years would be okay. If you're in that high-risk category, every year or two you should be checked. And glaucoma is an age-dependent disease. So if you're 80, your risk of getting glaucoma is probably 10 times higher than if you're 40. So it does increase as we get older.